Hello, welcome to today's live. Today we are going to talk about using Clomid for infertility treatment. So I'm just going to be looking at my notes and we are going straight into today's topic. No introduction, no delay, just give me a moment. Okay, welcome once again. Today I already said we're going to talk about Clomid for infertility treatment. Welcome to the Weekend by Health Afford. If you've been following us for a while, you know that we talk about everything concerning baby care and including infertility, treatment, management, investigations, the causes. Because if you look around you, in recent statistics, there's been a higher rate of infertility all over the world. So it's something that we have to talk about. Now, one of the popular drugs when it comes to infertility is Clomid. Clomid is very, very popular. Go on YouTube, go on the internet. There's so much information about Clomid. So now, what exactly is this medication and what is it used for? And most importantly, is this something that you should try out? Those are the things that we're going to cover in today's video. So now, Clomid is also known as clomiphene. The major use of Clomid is when a woman has unexplained infertility, when they cannot determine the exact cause of the infertility. So what this means is that the woman has gone to see a gynecologist. They've done all sorts of tests, be it high vaginal swab to check for infection, pelvic scan, a transvaginal ultrasound. Maybe they've also done HSD. They should have also done HSD to make sure that the fallopian tube is not blocked. A variety of investigations, hormonal profile too, knowing that okay, the hormones are okay and there's nothing, they can't really see what is wrong, or they can't determine why the woman is not getting pregnant. And remember that infertility is classified as when a man and a woman have been trying to conceive for at least 12 months without using any form of protection or contraceptive. So if you're using contraceptive January, February, March, April, and then you started and in December you're thinking, oh, I'm not pregnant, it's infertility, you have to wait for at least 12 months. You have to try for 12 months before you can describe it and say, okay, maybe there's a problem. So Clomid is primarily used for people that they cannot really explain the cause of their infertility. And what the medication is used for is to stimulate the follicles, and cause ovulation. So what they are trying to do is there's a term called super ovulation. So what they are trying to do, or what the doctor is trying to do, is get the woman, to ovulate and produce more than one egg. Because if there is more than one egg, it increases the chances. Let's say maybe 3 eggs are released. The ovaries release 3 eggs during ovulation, then the chances are higher that at least one of those eggs, will fertilize. So what the drug basically does is it increases follicle stimulating hormone and luteinizing hormone. These two are very, very important when it comes to ovulation and pregnancy. So for ovulation, the medication is supposed to stimulate the ovaries to produce multiple eggs. So once they produce, the ovary produces multiple eggs, like I said earlier on, it increases the woman's chance. Now, when I see so many videos about Clomid on the internet, my primary concern is anybody anywhere, can just think, oh, I've been trying for a few months, I'm not getting any results, maybe I should quickly try Clomid. No, you're not supposed to do that. You're supposed to follow the process. Why? So that you don't take yourself backward. Let's say now, for example, the reason why a woman has infertility or she's experiencing infertility is because her fallopian tube is blocked. Now, how do you find out that your fallopian tube is blocked? You have to do an investigation called HSG. So HSG is a procedure where they will introduce a dye into the fallopian tube and then take, the image of the fallopian tube, and then they are able to determine if there is blockage or not. So if you're taking Clomid and the fallopian tube is blocked,
you are causing more harm to yourself because you are releasing multiple eggs. Meanwhile, there's blockage in the fallopian, so the sperm cannot meet the eggs. So it's the same thing if you don't do an investigation with your partner. Let's say the problem is from the man, is having low sperm counts, poor quality sperm, or maybe the sperms are deformed, and you are taking Clomid as a woman. It's still the same thing. You are not going to get the desired results, and it's going to give you a lot of heartaches. So that's the reason why anytime I want to talk about this particular medication, the first thing I like to talk about is make sure that you visit a doctor, and the doctor has outlined, done all the necessary investigations and determined that okay, you are fit for this particular medication. So now let's just recap some of the things that causes infertility. One of the things that causes infertility is hormonal imbalance. Another thing that causes infertility is if the woman is not ovulating. If her ovulation is irregular, she cannot really determine the pattern of ovulation. And I think in my last video I spoke about some of the very, very vital investigations that you need to carry out. For men, is semen analysis, semen MCS. Semen MCS is microscopic culture and sensitivity test, testing for infection or anything that can, affect the quality of the sperm. Then semen analysis is just checking the sperm count, checking sperm morphology. There's so much. It's not only about low sperm count. If the sperm is not swimming the right way, if it is not the right shape, if it doesn't have enough energy to swim to the egg, all of this will cause problems. So it's not only about sperm counts, and that is the reason why you should see a professional. Don't just go online or listen to YouTube videos and then just take action on your own. You really need to see a professional to give you the right diagnosis and the right treatment plan. Now, I talked about some of the professionals that are involved in anything that has to do with infertility. The first person is a gynecologist. Even a man will have to see a gynecologist first. Then, if it is something that they need to refer, maybe it is a problem with the man's reproductive organ, then they will refer to someone called a urologist, for further assessment and other advanced treatment and investigation. Today's video, I'm not going to take our time. Already I've talked about some of the investigations for men. If you see me looking down, I'm looking down at my notes, just to make sure that I give you all the accurate information. So I already talked about some of the investigations for men. Then for women, like I mentioned earlier on, I said hormonal profile, very important to see if the hormones that are supposed to help with ovulation, implantation, if all of those hormones are adequate enough in the body, or if there's an excess of any of them. So you have follicle stimulating hormone, you have luteinizing hormone, you have prolactin. If there is excess prolactin in the body of a woman, it could cause infertility. Another thing again is sometimes they will do a thyroid function test because all of these are related. So what Clomid does for a woman is that it's going to activate the pituitary gland to release two important hormones, follicle stimulating hormone and luteinizing hormone. Now, follicle stimulating hormone, just like the name suggests, it will stimulate the follicles, to produce eggs and release them during ovulation. Like I mentioned earlier on in this video, we're talking about super ovulation, releasing of 2 or more eggs, so that it increases the woman's chance of fertility. What is the dosage and recommendation? Like now, the first thing I said in this video is Clomid is not for everybody. Clomid is for women that they have determined that okay, we have done all the necessary tests and we cannot determine the problem. Your hormonal profile is okay. They've done HSG, there's no blockage in the fallopian tube. They've done a pelvic scan, they've checked everything and they can see that everything is okay. So why is this woman not getting pregnant? Why not just the woman? Please, when I mention woman, I'm talking about the use of Clomid in women. So it's not like I'm trying to say infertility is a woman's problem. So what I'm trying to say is that they've done investigation for the woman, they've done investigation for the man also. The man's sperm count is okay, the sperm quality is fine, there's no problem. So now the next step is they've done investigations for the couple. They've done investigations for the couple and they realized that there's nothing wrong, there's nothing that they can place their hands and say, okay, this is the problem, so they go for Clomid. Now the dosage, it comes in 50 milligram, and that A is taking 50 milligram does not mean B will take 50 milligram. The dosage is very different. So don't run off and call your pharmacy friend and start ordering for Clomid. You need to get the right dosage, because everybody's situation is different. And like I said, you need proper investigations from a specialist to determine how much of this medication you will be needing if you decide to go for it. So like I said earlier on, it has to be recommended by a doctor, and the physician or the specialist that you're supposed to see for this is a gynecologist. Now there are other medications that act like Clomid. We have letrozole. So letrozole is another medication like that, but letrozole has a primary function. And letrozole is primarily used for women that have breast cancer. It is used in cancer treatment. That is the primary use. Then the secondary use, just as like a side use, is that it can also work the way Clomid works. It can also work the way Clomid works. So that's the reason why sometimes you see people say, oh, Clomid versus letrozole. So I just want to tell you a bit about it. I intend to do a separate video about letrozole, and just finding out that the primary use of letrozole is actually for in treatment of cancer, like breast cancer. It's just to show you that because you hear a medication online, or somebody mentioned it online, or you saw it in a YouTube video, you can't just rush off to the pharmacy and say you want to, purchase it, because whatever doctor will be administering this medication to you or recommending it for a particular treatment, he knows the right dosage and he knows how you are going to use it. So now letrozole is very good for women that are experiencing infertility because they have PCOS, which is polycystic ovarian syndrome. PCOS is a gynecological disorder. It has a vast variety of symptoms, signs, and one of the side effects of PCOS is increased chances of infertility in women that have PCOS. So what it does is that it just increases the estrogen in the body and stimulates ovulation, just the same way that Clomid works. But like I said, it has other uses. So please hold on, I'm taking a look at my notes. So another thing I want to talk about is, a lot of times I see a lot of videos about Clomid, and they are saying, oh, use Clomid for twins, use Clomid for multiple pregnancies. Yes, I know that Clomid helps to produce 2 or 3, it produces 2, 3 or more eggs, so that it increases the chances of a woman getting pregnant. Some people have now used it as a hack for, say if you want twins, use Clomid. Well, personally, I don't really encourage people to just I don't know, let me know in the comment section, do you think it's a good idea if you are craving twins or you want twins, and then there's nothing wrong with you don't have any fertility issues, you just go and get Clomid so that you can have twins? Please, I don't want to make any comment on it. Put it in the comment section. Let's discuss. Is it a good thing to actually decide to induce twins by yourself because you have the information? Let us know what are your thoughts. Okay, now, so I've talked about the dosage for Clomid. Now, like I'll keep repeating this, you have to see your doctor or specialist to direct you on how to use it. Now, if you want to use Clomid, you have to start taking Clomid for from the second day of your menstruation. Today is 15. So let's say you start menstruating today, you won't take it today. Tomorrow is 16. You start taking it from tomorrow, the second day of your menstruation, and you have to take it every single day
for 5 days. You have to take it every single day for 5 days. And like I said, it comes in 50 milligrams tablet, and it's only your doctor that can tell you what you are supposed to use, how many tablets you are going to use of this medication. So don't stay at home and self-medicate. So I'm going to stop the video here. If you've learned something, if you have questions for me, please let me know. If you have questions for me, please let me know. Okay, so I'm just going to recap all I've said. We've actually come to the end of this video, but I'm going to recap some of the things I've said today. I talked about Clomid, and I said Clomid is a medication that is used for women that have unexplained infertility, and it has to be recommended by a doctor. And I talked about infertility. How do we classify infertility? Infertility is when a couple, a man and a woman, have been trying to conceive. They've been having unprotected intercourse, and they are not using any form of contraceptive, and they've tried for 12 months without achieving pregnancy. That is what infertility is. What does Clomid do? What Clomid does is it activates your pituitary gland in your brain to produce follicle stimulating hormone and luteinizing hormone. So these two hormones are going to be responsible for what we call, especially this FSH, which is the follicle stimulating hormone. It's going to be responsible for what we are going to call super ovulation or multiple ovulation. You're going to be producing more than one egg. So the rationale or the reason behind it is that if a woman produces more than one egg, that if she has 3 eggs, it increases the chances of her. I said this is for unknown causes of infertility, which means you cannot sit at home and go and buy Clomid. You have to have consulted your doctor. They would have done several infertility investigations, such as hormone profile, HSG, to check if the fallopian tube is blocked. Remember, if the fallopian tube is blocked, the sperm cannot meet the egg. So even if you produce 3 eggs, if the sperm cannot meet with those eggs, fertilization will not occur. You have semen analysis and semen MCS for the man. You have ultrasound pelvic for the woman, pelvis for the woman. I already spoke about hormone profile, HSG, and many other tests that will be conducted. I talked about the dosage and recommendation. Clomid comes in 50 milligrams, and it is recommended that you start taking it on the 2nd day of your bleeding, like when you see your period. The 1st day, like today is 15, you won't take it that day. If it's today you're seeing your period, you start taking it on the 16th, and you take it like that for 5 days based on your doctor's recommendation. Very important. Then I also said, there's a lot of online blogs, Clomid for twins, Clomid for multiple pregnancies, and I said, leave it in the comment section. Is it good to use Clomid? There's nothing wrong with it. You don't have any form of infertility, you just decide I want twins, and then you go and buy Clomid. Is it a great idea? Please let us know in the comment section. Then I also talked about another medication that behaves like Clomid. I talked about letrozole, and I said I was going to speak about it in another video. So that's the recap. If you've learned anything, please drop it in the comment section. This video is going to be on my channel even after this live. So thank you for staying tuned. I'll see you in my next video. Bye.